Hello, you're watching Wellness Watch on DD India, your weekly dose of wellness and good health. We all want a long life, but more importantly, a healthy one. Imagine a normal day in your life, laughter, conversation, routine, and suddenly everything pauses. The body stiffens, the world blurs, time feels suspended. Our brain, the most powerful organ in the body, running on tiny electrical impulses every second. And when these impulses become sudden electrical storms or misfire like a short circuit, epilepsy, a neurological condition, strikes. A few minutes, that's all it takes, a brain to misfire. And for many living with epilepsy, unpredictability becomes a part of daily life. Today in Wellness Watch, we discuss epilepsy, a neurological disorder often feared but rarely understood. I'm Preeti Kaur. Epilepsy is a neurological condition that causes recurring seizures and affects people of all ages and backgrounds. Despite being common, it is often misunderstood. Seizures can look very different from person to person, and myths about treatment are still persistent. Understanding how epilepsy works and how it is treated today is the key to reducing fear and improving lives. Here's a report by DD India's Harshita Oberoi.
Epilepsy is a disorder of the nervous system in which a person experiences recurrent seizures. Our brain contains billions of nerve cells called neurons. These cells communicate through electrical and chemical signals. Normally, this electrical activity is balanced and controlled. But when there is a sudden abnormal electrical activity in the brain, it can trigger a seizure. Seizures may last from a few seconds to a few minutes. In some cases, the person may lose awareness or consciousness. Depending on the area of the brain involved, symptoms can vary. A person may stare blankly, experience jerking movements, lose awareness, feel sudden fear or confusion. Epileptic seizures are broadly classified into two types: focal seizures, which begin in one area of the brain, and generalized seizures, which involve both sides of the brain. Some people experience warning signs known as auras just before a seizure. These may include unusual smells, tastes, flashing lights, dizziness, or a rising sensation in the stomach. Epilepsy can affect anyone, children, adults, or the elderly. In many cases, the exact cause of epilepsy cannot be identified. In others, it may be linked to genetic factors, head injuries, stroke, brain tumors, infections, or injury before the birth. Additionally, triggers like alcohol, lack of sleep, stress, or flashing lights can provoke seizures in people who already have epilepsy, although they don't cause the condition itself. The turning point for many patients comes with accurate diagnosis. Doctors use neurological exams, blood tests, and advanced brain imaging like EEG, MRI, CT, and PET scans to identify seizure types and origins. Treatment options today provide strong seizure control for many people. Primary treatments include anti-seizure medications, surgery, neurostimulation devices. Treatment plans are individualized based on seizure type, frequency, age, and response to therapy. While epilepsy cannot always be prevented, risks can be reduced by protecting the head from injury, treating the infections promptly, maintain healthy pregnancy care, following medication strictly, regular exercise and balanced diet, avoiding known seizure triggers. With proper care, people with epilepsy can lead to safe and productive lives. Epilepsy is not a curse, it is a medical condition, diagnosable, treatable, and manageable. Awareness, early treatment, and the right response during a seizure can save many lives. Harshita Oberoi for Wellness Watch, DD India.
All right, so epilepsy is a brain condition that causes recurring seizures. It is also common and affects people of all genders, races, and ethnic backgrounds, and ages as well. Around 50 million people worldwide have active epilepsy, making it one of the most common neurological diseases globally. It affects all ages, but up to 70% of people with epilepsy could live seizure-free if properly diagnosed and treated. Epilepsy affects approximately 10 million people in India, accounting for nearly 1/6 of the global burden. About 500,000 new cases are added annually, often driven by infections, trauma, and a significant treatment gap. Today in Wellness Watch, we look for these answers. What is epilepsy? What are the main types of epilepsy? What are the causes and triggers? Can epilepsy be prevented? And we also take a look at what are the medical advancements that have been made in India. Epilepsy treatment in India involves a comprehensive approach including anti-epileptic drugs, specialized ketogenic diets and also advanced surgery for drug-resistant cases. Treatment costs for epilepsy in India are relatively lower as compared to Western countries while maintaining high international standards of care. Upon your screens, we get to some institutes and hospitals which cater to this. All India Institute of Medical Sciences, Delhi, Safdarjung Hospital, Delhi, the National Institute of Mental Health and Neurosciences, Bangalore, King Edward Memorial Hospital, Mumbai, Postgraduate Institute of Medical Education and Research, Chandigarh. To help us understand epilepsy better and how can it be prevented and treated, we're joined in by doctors, we're joined in by specialists. In fact, in the studio, we're joined in by Professor Shefali Gulati. She's faculty in charge, Child Neurology Division, Department of Pediatrics, AIIMS. She's joining us in the studio. And virtually, we have with us Dr. M.V. Padma Srivastav, Chairperson, Neurology Department, Paras Healthcare, Gurgaon. She was also the past Chief of Neurosciences Center, AIIMS, New Delhi. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Padma, I would want you to explain to our viewers in very simple terms, though we've shown a detailed report, what is epilepsy?
You know, you actually gave such a wonderful synopsis of the whole thing. There's a little and actually I can add on to. But as you rightly said, this is the most common presentation to a neurology clinic after headaches. You know, after the pain syndromes, it is the seizures or epilepsy with which people come to the clinic. And as you said, 10 to 15 million people in India, humongous burden. So therefore, epilepsy as such being so common, and as you rightly said, the problem with epilepsy is a huge treatment gap because people, one, even if they do recognize, they don't want to label it as a seizure. There's still a lot of myths and misconceptions. So even though, as you said, in India, the treatment is so much cheaper, easily available, you can treat it fast and adequately and well, people don't come forward because still we are grappling with situations where they want to ignore. There are stigmas. There's still myths and misconceptions which lead to a big treatment gap. Therefore, as I understand, Preeti, beyond what you said, yes, epilepsy is a common condition. It's because of this abnormal signaling pathways in the brain. So lead to sudden problems like either a focal or a generalized. Generalized is where they lose consciousness. It looks grotesque, it looks fearsome, or it could just be focal seizures, which are sometimes very eminently missed, especially Shefali would tell you about in children, where there could be, you know, various ways they could be missed. But if you don't treat it well and in time, something which can be nicely controlled in 70%, in fact, I would say 70 to 75% of cases, it can be controlled. A lot of times we stop the medication. They're well. It's never this that you have to take medicines forever in your life. No, it only happens if it becomes intractable, poorly controlled. A lot of times it's also because becomes refractory because you've not
Yes,
given
so timely
the right
treatment is the
right
crux.
time.
Yes.
Yeah.
All right, Dr. Shefali, I'll bring you in here. How is a seizure different from epilepsy? Or if I could put it the other way around, do all seizures lead to epilepsy?
Seizure is a manifestation occurring because of an abnormal excessive electrical discharge in the brain, right? And that can lead it to one event which can be like the moment we know about the both hands moving, or it may also be only numbness of the hands, you know, that can be in certain of the focal ones. But they can be different manifestations in the pediatric one, which I will be also mentioning before I end this part of it. But the epilepsy is defined as 2 or more unprovoked seizures occurring within more than 24 hours apart. Or, you know, sometimes what happens is in childhood also, especially, you have so many provoked seizures. The most important provoked seizure is febrile seizure, because every up to 10%, 5 to 10% of children in the pediatric age group from 1 month to 6 years of age may have a febrile seizure, but they will not end up in having epilepsy. So epilepsy is recurrent unprovoked seizures, more than having more than 2 episodes 24 hours apart, or sometimes when you have something abnormality in the brain due to some malformation or any other metabolic or genetic condition which is predisposing, then even after one seizure you may have. And you may also have, third is epilepsy syndromes. The commonest one, as what Dr. Padma was mentioning, that there are certain things which are missed in pediatrics, is like infantile spasm. They have sudden jerky movements, like the people feel that the child is just getting startled, but these are actually jerky movements, either isolated or in clusters, which are called as West syndrome. It used to be called as, now it's called IESS, and that gets commonly missed both by the parents feeling that it's just startling in a child, and even by pediatricians feeling that it will just come out. So these are, there will be these differences are there.
All right, Dr. Padma, what are the main types of epilepsy, and also what are the causes and triggers?
So the types of epilepsy has already been described. One is that they're generalized. They could be primary or secondary, simplistically. Primary is that, there is, it's not because of there is a brain tumor or there is, a brain injury. Could be because of a syndrome. It's because of what electrical activity per se. A lot of them could be a genetic basis. So primarily they do lose consciousness very quickly and they become generalized. They have this tonic-clonic spasm. They lose consciousness. The other variety are partial and they could be secondarily generalized, like they start off with motor. You just have jerky movements. They may lose consciousness, they may not lose consciousness. They could be sensory. There's something very funny happening, felt. Could lose consciousness, not lose consciousness. Or they could be complex partial, where they are still conscious, they're not falling down, they're not jerking all over, but they lose contact, they're not responding to you. And they could have automatisms, like they have smacking movements of the lips, or they're doing repetitive movements. They're just staring blankly. So these are all where they don't have a, they're not aware of their surroundings. So they become partial complex. Largely, I'm not going to get into detail of every single type, but for a general public, this is how you classify focal, generalized, primary, secondary, partial complex. And this is important to understand. The other thing what Dr. Shefali said, myoclonus, they're jerks like this. And in children, there are other varieties. Your absences, your complex absence, your tonic, your atonic. Let's not get into detail about those different varieties. Largely, it is important to classify because the drugs which are optimal in a particular condition will be a little different. We classify the management according to it. And the causes, Preeti, we actually determine the cause according to the age as well. Right. Like, a newborn, a little child, an adolescent, an adult, an aged person. So in this, the causes may be, more common than the others. In childhood epilepsy, a lot of epileptic syndromes and genetic varieties, a whole lot of other things, but a very common cause would be perinatal injury, just the birth injuries. Births being normal, you sort of prevent a lot of those things. Second thing, in adults, adolescents and others, you have infections, of course, across the board. And then you have trauma, stupid road traffic accidents. You don't wear helmets, and then there's an injury. There's an acquired cause. Then you have caused your brain tumors, and in elderly and others, you have strokes, which are very, very common. So any brain injury, whether it's infection, it's a trauma, it's a tumor, or just scar from any other things which has happened in life, can lead to an electrical impulse. Right. So the causes most commonly will determine, this is the commonest cause, next according to the age with which they come.
All right. All right. Dr. Shefali, at what age does epilepsy start? Yes. And also, or if I could say that, how does a person develop epilepsy?
Okay. Epilepsy can be intrauterine as well. A child in the womb also can be having. So there are certain metabolic conditions which we start suspecting if the mothers say that there were some abnormal movements are happening during the child being in womb. Right. So that is, there is no age, like it can start from fetal life, yes. And as
so a person can be born with epilepsy, is
yes,
what you
because,
said?
because there are certain metabolic conditions like peridoxin seizures which will be there intrauterine also they can be felt, yes. Okay. So basically depending on cause, which causes, so which Dr. Padma has already said, said, most important preventable cause will be having the prevention of birth asphyxia, having a trained birth attendant giving a delivery in hospitals, because that becomes the single most important preventable causes of epilepsy. So you may have in newborns, and as mentioned that you may have different manifestations. What the general people should understand that everything which shakes, like this generalized tonic-clonic movements with frothing of mouth and all, which we take it as epilepsy, may not hold true in pediatrics. Newborns can have certain abnormal cyclic movements, abnormal chewing movements, so those things also with the vacant stare and all can be manifestations of epilepsy per se. And also, as Dr. Padma was mentioning of absent seizures, in the school the parents may be told that the child is becoming transiently unresponsive for few seconds, and that is actually when you see in the outpatient and ask the child to hyperventilate, we say he goes into a trance, so that's childhood absence. So you may have at any ages, and they may be different varied manifestations which are important. And another preventable cause in the pediatric population is neurocystic, which is an infestation which happens because of improperly washed fruits and vegetables, and most of the children love chow means, having coleslaw sandwiches, and all those things. So that is why it's very important to properly wash the fruits and vegetables, because of cabbage and coriander is the basic problem, because they are used cooked or semi-cooked in most of the things. So those things have to be kept in mind.
Can a seizure be fatal?
Yes, seizure can be potentially fatal, because you may have some vomiting and all taking place and secretions coming out, and especially for children you may end up having aspiration, and aspiration during the episode of seizure may cause a death. That is one thing, and that is why you are asked that whenever anybody has seizures, then you are told that what is the recovery position in the home, what the parents should do, put the child in lateral position and all, and that is very, very important. Another fatality comes SUDEP. SUDEP is you have sudden, unexplained death happening in these children with epilepsy, which are more seen in, intractable seizures.
Yes, and time and again we are flashing on our screens the AIMS 24 hours neurology helpline for the benefit of our viewers. Dr. Padma, I'll bring you in here. What should one do during a seizure? For a person experiencing a seizure, is difficult, and for the people who are around him, that is equally difficult. So for the people who are around the person experiencing a seizure, what precautions or what care should be taken?
Absolutely, Preeti, and I think this is as important, people trying to learn CPR seriously, because the most important thing out here, if you do have a generalized seizure on the road anywhere, is to prevent further damage. So quickly try to put the person in a they are hitting against it, try to put them on one side. Don't forcibly open the mouth and push something inside. That's a very common thing. So therefore, prevent aspiration. So they shouldn't be lying down flat like this. The tongue goes back, they will aspirate. They won't have oxygen, they may die. So put them on one side. Don't forcibly put anything. Don't damage the teeth. Don't put your finger into it, the finger will get bitten. Don't put those metal objects. Just let it be. It will pass in 3 minutes. Don't forcibly try to put in water or anything into the mouth. And least of all, please don't go in, but then sungna hai, wo kya hai? Shoe, or all those things. It still happens. So don't do all those things. So basically prevent further damage. Put on to one side. Don't forcibly open the mouth. Don't thrust anything inside. If the mouth is already open, then you can put something soft so that they don't bite the tongue. But if it's already closed, don't do it, and don't feed or put into the mouth anything when they are unconscious. When they're unconscious, don't feed, don't do anything. Put on one side so that the tongue is not falling backward, the aspiration is not going, the secretion is not going on the wrong side. In 3 minutes, 4 minutes, they come around. They're not. Please transport them to the nearby hospital. But while waiting for it, this is what you need to do, wherever it is. And you recognize that this is a seizure and you have to take help.
All right, Dr. Shefali, get us more about pediatric epilepsy. You've talked about how it can start in the womb itself. Do the symptoms or do the manifestations, continue through adulthood? If once started, or for that matter, as the child grows, does the child really outgrow these symptoms?
Actually, there are varied causes of epilepsy, seizures and epilepsy. So, depending on the causality of the seizures, the final prognosis and outcome will depend on. Because if you are having a metabolic disorder, they may be continuing for long. If there is any other genetic disorder, it may be continuing for long. But things like neurocystic cirrhosis, which are there, they get well and they will be there for only short time. Once the cyst has resolved completely, then even after 6 months of seizure free, we start tapering the drugs. But if the cyst has calcified, then we give after 2 years. So, and that is something, because it will depend on whatever the causes which are there. If it is regarding head trauma, you may be required to give for some time. But if the head trauma has led to scarring in the brain, which is a gliatal scarring, you may have later on epilepsy. So it will all vary depending on various causes. They can be, the outcomes can be relatively benign, because many of the neonatal seizures may just get well on their own if the child is otherwise okay. There are certain benign ones, and there are some very difficult to treat epilepsies which may have genetic, metabolic and malformations as the underlying causes. So the prognosis depends on what is causing it.
All right. So a child with epilepsy, can he lead a normal life? Is the growth normal?
One thing very important to understand, when the child has epilepsy, due to varying causes, there will be the coexisting comorbidities which are going to guide. Because if you are having a developmental delay, if you are having a cerebral palsy, you are having associated autism, all these are going to modify the child's condition. So, but otherwise, if somebody who is developmentally not challenged, who is developmentally going fine, in that situation, if it is not difficult to control epilepsy, they have a good outcome. And most of these epilepsies, as mentioned, in pediatrics also 60 to 70% of the epilepsies get control with 1 to 2 medications, and they do relatively well. And the other ones will be drug refractory, which may be requiring more antiseizure medications, various dietary therapies, and various neuromodulations and epilepsy surgery in certain situations.
All right, Dr. Padma, quick word on what does success mean like when we talk of medication? Does it mean a person is seizure free? Does it mean that it is manageable? How does a person know that the treatment is going in the right direction?
Seizure free? It's a no-brainer. You're not supposed to have seizures. So the seizure, in fact, there is something like a seizure freedom and a seizure control. So when you're testing medications, you're looking at 50% reduction from the previous seizures number and all. But what I would want, what a person with epilepsy would want, is a seizure freedom. So that would be the actual thing, and the sustenance of the freedom. You need to remain seizure free for a considerable length of time, so that at least after 3 years or 3.5 years, you're able to reduce the number of medication, get off the medication. That is what is needed, and that is achievable in majority of the cases. And that's important to convey to people that, look, this is also a disease which is controllable if you take the right drug at the right time. And also, you see, Preeti, when you bring in these precautions, like, you always have, just like, don't drink and drive, don't text and drive now.
Yes.
So you cannot drive, you can't ride, you can't swim. There are certain precautions, because if a seizure happens during that time, you're threat to yourself, threat to others.
Yes.
So these, do's and don'ts and the triggers. If you're taking drugs and you're staying up the whole night, late night and disturbed sleep is a very common trigger, especially in primary generalized epilepsies. And the young people who says, I'm doing everything right, and you're doing night shifts, or you're staying up the night texting and you're on a mobile app. So these are little bit, kind of a lifestyle modifications, and they go a long way in controlling epilepsy.
A quick word on medical advancements that also have been witnessed in India when we talk of epilepsy, ma'am.
Yes, and I think humongous advances. And as you rightly put out in the beginning, that these advances were also commensurate in making it more affordable, accessible, and available to majority. And I think that has been the USP of India, because consistent advancements have been taking place across the universe. In India, we've kept up with those advances. One, the kind of pharmacopoeia, we have newer drugs with a better safety and better, the efficacy profile. We have a better understanding of how we combine these medications, and most advanced medications are available, and most of them are generic, so they're much more affordable in India. Second, beyond the pharmacopoeia, we also have the epilepsy surgeries, and also in surgical advancements in localizing the epileptic focus in a drug refractory epilepsy in terms of the imaging, advances in imaging, newer forms of surgical modalities make it much more less, sort of, they are not blood drainage systems, they're blood saving things, they are very, very, what you call very focused, and so they have little damage after a
Right.
surgical procedure. And the the neurostimulation methods and the diet, ketogenic diet has been there for a while, but even that, of course, Shifali can elaborate on that. So there are a lot of advancements in trying to localize where is this epileptic focus coming
Yes.
from. Number two, how to take it out in a more refined, focused, and least damaging method possible.
All
That
right.
advancement has come.
All right, so a quick reminder for our viewers. Up on our screens, we'll flash the AIMS 24-hour
Child Neurology Helpline.
The numbers are there on your screens, 9873638521, 9953742140, 1800117776. And now we'll have a quick rapid fire round for some myths to be cleared. Dr. Padma, epilepsy is a mental illness, is it?
No.
Dr. Shefali, flashing lights cause epilepsy in everyone.
No, it may be a trigger in some.
You should put something in the person's mouth during a seizure, Dr. Padma.
No.
You can
No.
stop a seizure by holding the person down, Dr. Shefali.
No.
Someone with a seizure must be rushed to a hospital, Dr. Padma.
I think so, yes.
People with epilepsy should avoid exercise or physical activity, Dr. Shefali.
No, but they should avoid contact sports and unsupervised swimming and cycling like that initially when they are not controlled.
All right, so with this, we end this discussion here. Thank you so much, both of you, for joining us and helping us understand epilepsy better. So after
Thank
this
you.
discussion, we did understand that epilepsy is a medical condition, neither a weakness nor a curse, but with right treatment, support and awareness, epilepsy can be treated and seizures can be managed. Remember, the brain may misfire for a moment, but hope should not flicker. With that, we end this edition. Till we meet next, take good care of yourselves. Bye-bye.